How in the world can you fix that, or how do you tell if that muscle has been damaged, or that it's not moving the eye properly, or that there's a fracture in the how do you fix it? To me, it's getting where you need to get an oculoplastic surgeon.
Sure, so this is an area that a lot of physicians can handle, and you do want to have an eye exam to make sure there aren't any problems with the eyeball itself. But once that's done, you evaluate each patient on a case-by-case basis. It's nice to have a CT scan with thin cuts through the face or through the orbit specifically to evaluate the fracture. But telling whether or not there's true entrapment in that muscle is really a clinical diagnosis. It's something that a physician has to look at. They'll check your eye movements in all directions, and then if you're not moving your eye upwards appropriately, that usually means that that one muscle is trapped or at least pulled down into the defect. Now, if that's the case, they may have to do another test. We call that forceductions, where we're trying to force the eye up to see if it's trapped or if it'll move. Once we've established that there's a fracture, and if we decide that it does need to be repaired, and this is either an oculoplastic specialist, oral maxillofacial surgeon, ear, nose, and throat physician, or a plastic surgeon, we would often go in through the eyelid and elevate all of the contents of the eye socket that have gone into that defect or into that fracture, take them out, and then usually put a little implant or a plate underneath to support them so they don't go back down.
When you have a blowout fracture like that, how often is the surgery successful, or how often does it lead to blindness?
So blindness is a very, very rare and very feared complication of the surgery. I would say it's very, very unlikely if in the hands of a good surgeon who's comfortable working in the eye socket. If you have to have a fracture repaired, it is usually very successful. It's a procedure that's very effective and has very good results in the end for the patient.
What I'm hearing you say is basically the eye is so important. There's so many things that can go wrong, but they can all be fixed with the proper technique, with the proper training, with the ability and the knowledge to take care.